Hello, Work So Well family. I'm so glad that you joined us today. We have a very important show. We're going to talk about a very difficult subject. We are very privileged to have Dr. James Anthony, our Chief Medical Officer, who's going to join us very shortly. And the subject is feline stomatitis. It's a very complicated disease. It's a very ravaging disease and very difficult for the patient, and of course, very difficult as well for you as a pet owner. So, what we wanted to do is help you, provide you a guide to to share with you what our chief medical officer, a veterinary dentist, he's got well over 30 plus years of experience as a dentist, dealing many times with feline stomatitis. What we asked him to do is to provide us a guide of what he does. What are his phases when he's faced with the situation clinically? So that's what this is. There's a guide that's available for you folks that he's going to go through. You can have access to this guide. It's 100% free. It actually, if you look down below, there should be a stream of where you can access that. It is going to be at WSOW for Work So Well .live/stomatitis. So I would encourage you to do that. It's free. I would also encourage you to share this video if you're watching it on Facebook or YouTube, where you could share with other pet owners, perhaps that might be dealing with or suspecting that they might be dealing with feline stomatitis. So we're looking forward to go over those 4 phases with you for purely an educational aspect. Now, keep in mind, if you're talking with another veterinary dentist, they may have some personal nuances to what steps they personally take. So this is Dr. James Anthony's personal guide on how he manages stomatitis clinically. So without any further ado, let me bring Dr. Anthony with us. There we go. Dr. Anthony, thank you so much for taking the time to join us today.
Pleasure to be here, especially on such a important subject matter.
Yeah, we're thankful that you took the time to really write down this guide for us that our audience will be able to have access, and we'll keep that live so you can access that really forever. So I think we should dive right into it. You were gracious enough to really break that down for us in really clear steps in 4 phases. So going right into it, how you personally have been dealing with this clinically, tell us about those 4 phases. And let's start with phase 1. What is the first phase that you go through, Dr. Anthony?
Well, just before we start, I just want to say that I try to go through a systematic approach, so there's not redundancy or basically extra cost to the owner and that type of thing, because this can be a very expensive disease process that can add up. And basically, we try to keep things as basically cost efficient as possible, but we want to do the right thing for the pet. We don't want the pet to suffer. So what I do is I try to keep that in mind when I do the 4 steps. So basically, the first step is basically a consult. So a consultation with the owner and the pet. And what we're trying to do there is do a general evaluation to see what is going on with the pet and the mouth together. Because a lot of times, a lot of these things are stomatitis, but is due to other factors. For example, chronic renal failure. You'll have ulcers all over the mouth, and if you treat it like a stomatitis viral infection, you're not going to get anywhere. So there's some basic things that we want to do in that consult that will give us a very good idea of what differentials we'll have as far as the disease itself. The first thing is a good physical examination and basically history of the patient as well. So we want to know basically, is it drinking more, drinking less, because that could mean that it might have diabetes, for example. Or basically a physical exam, if you see that there's multiple broken teeth in the mouth, that's really painful. And of course, the animal is going to be uncomfortable. So what we'll do is we will do a full evaluation of the oral cavity and the whole body as well. And then what we'll suggest is to do some blood work. The blood work is to identify basically if there's any other factors, such as renal failure, liver disease, those types of things that are contributing factors to the stomatitis. We also, a lot of times, will do viral testing, and that basically tells us not if it's going to be caused by these things, but rather what factors are involved, such as calicivirus, herpes virus, and there are a few others. Feline leukemia virus, feline immunodeficiency virus, all of these will make the stomatitis situation worse, and it
Mm,
also acts as more of a prognosticator. So in other words, it tells us, okay, are we going to be dealing with for life and it's going to be hard to deal with, or is it going to be something straightforward? Okay. And then what we're going to do is try to basically evaluate the owner. Basically, can the owner do home care, some home care for the pet? Because if that limits what we can do as far as treatment. If a person can't or will not do home care, well, it limits us on what we can do to aid in that for that pet. Also, we want to know if the patient will be cooperative with that as well, especially if things are resolved in the mouth. And the other thing is also, and you never like to talk about this, but can the owners really afford this,
mm,
or can we only give systematic or symptomatic treatment, which is not really that beneficial? I mean, there's going to be a lot of times there that's not going to be helpful for the pet at all. So, we have to be realistic about these things right up front, because if everybody's frank about things, we will have a much better outcome and far better success. Excuse me. Then, based on the findings that we have, we'll have create a battle plan per se for treatment, and basically give those options. There might be several options based on what it is, and as a result, gives an idea of where we're going. So it's a step-by-step approach to things. And initially, basically, we may give some antibiotics, we may not, but we'll definitely do some home care products to aid in helping basically clean the mouth and also improve the condition of the tissues. So the products that I use are 1-TDC, basically for its anti-inflammatory effects to decrease inflammation, and basically as a result allow for faster healing of the mouth. With that product, after a month, I usually see that at least the fissures of the ulcers, in other words, are almost gone.
mm.
So it may not be resolved, the stomatitis, but there'll be a tremendous improvement of quality of life for the patient. The next one is MaxiGuard. MaxiGuard is a zinc ascorbic acid-based product, and it's a mild antibacterial, but the most important aspect is it actually promotes formation of collagen.
Mm,
Collagen is the first tissue to be destroyed in gum disease. And as a result, with stomatitis, there's a lot of collagen loss. So this helps promote collagen formation, so it enhances the healing capabilities for the patient. The last one is a chlorhexidine-based product. Is basically what chlorhexidine is antiviral, it's antifungal, and antibacterial. And as a result, it cleanses the oral cavity. So these are more basic products that don't have, let's say, a lot of, any systemic effects on the animal, and as a result are very safe to use. So that's usually and then what I'll do is then we'll plan for the next phase. So which the next phase is basically confirming the diagnosis and treatment. So we get the blood results back first.
If I could interrupt you just a second, Dr. Anthony, because you covered a lot of ground on this. And if you just join us, we're with Dr. Anthony, veterinary dentist for many years, that is going through the steps that he takes in diagnosing and in treating feline stomatitis. And we just covered phase one, which is general evaluation. If you want a copy of this guide, it's down below. Just go to the address, WSO um, wsow.live/stomatitis, and you'll have access to the guide that he's covering right now. I just want to recap just briefly, if you don't mind, the general evaluation, which is your first phase. So the examination, looking at the patient, the blood work was very critical in what you described. I think that's a very important one. I really do like the fact that you're talking about the real things. Is what can you afford? It's an expensive disease to manage, and also importantly, what are you able to do with your cat, and what can your cat sustain? So that bond and relationship in this difficult time, I think, is very important. But it's interesting to hear you, because in what you're saying, you really are preparing the case, identifying the case, and your first steps. It looks like it's very proactive from a kind of a supplement or specific tools in the beginning. I also would assume that the blood work is very important for you to determine if the patient can go under anesthesia to begin with. I assume that's one of the key things as well before we go into phase two.
No, basically phase two, that's where you look at the blood tests and say, can it have an anesthetic, or do we have to do something else? For example, reduce the renal values in order to make it safe to have an anesthetic. And also whether or not maybe a boarded anesthesiologist on board is a need for safety purposes. So the blood work tells us an awful lot, but it also eliminates a lot of potential causes of stomatitis. Stomatitis is caused by many, many things. So it can be viral, it can be chemical, it can be traumatic. The list goes on, from periodontal disease, the list goes on. So as a result, there's many factors that one has to take. And the blood work eliminates a lot of those potential causes. So the second phase is basically what we want to do is have the animal under anesthetic, and the first thing that we would want to do is do biopsies. Biopsies are just taking little chunks of tissue from the oral cavity and setting them in for histological evaluation. So they look under a microscope with it and basically say what type of cells and cell types are there. The reason why this is...
Oh, go ahead. I was going to ask you, what are you looking for when you're doing that biopsy? What is the process?
Just going to say.
Go ahead,
well,
please.
What we're looking for is the types of cells. For example, there could be a tumor. Squamous cell carcinoma is a very common problem with cats. And as a result, if it's got squamous cell carcinoma, it's a total different treatment than what we would do for stomatitis. So it tells us what type of cells are there, whether it's truly an inflammatory reaction, or is there viral components in there? You can see sometimes viral clusters, but that's rare. It's just basically you have to have a pathologist look at that slide in order to see these things. So it tells us a lot of what's going on. And again, what we're doing is putting pieces of the puzzle together to find out what the diagnosis is. And as a result, that allows us to properly treat the case. Okay. Now, sometimes, and I'll give an example with juvenile stomatitis, which is in young cats, and usually it's from basically a lack of a proper formed immune system that's not fully developed. By giving it a little bit of care and help, such as those 3 products that we mentioned in phase 1, a lot of times it can be significantly reduced, if not almost eliminated. And as a result, we may just say, well, let's continue on with this and see how it goes. And as a result, that's a very inexpensive way to go. And the cat is happy. The owners are usually very happy because it's a lot cheaper and the cat is happy. So as a result, we will evaluate the cat's oral cavity before we put them under anyways, just to make sure that we're doing the right thing. Okay. But the biopsy, if there's still stomatitis, the biopsy is the key one to do. And excuse me, we want to basically make sure that we do those biopsies first, because we don't want to put things in the mouth that could distort or traumatize the tissues before we do the biopsies.
Got it.
Now, the next thing is we'll do full mouth x-rays. So it means x-rays of all the dentition of the mouth. What we're looking for there is a lot of times cats will break off teeth from what we call resorptive lesions. And these teeth are embedded there, but they're basically inflamed. And as a result, there's a lot of inflamed bone around there. And basically what we call inflamed bone. That'll be the best way I could give the scientific term, but I think that's not necessary. But the whole idea here is to see, if we see this, we want to get rid of that inflamed bone. So what that means is that we'll do an oral cleaning up the mouth, and removing any teeth that are basically not healthy. In other words, they're going to be problems. They're loser teeth. In other words, they're going to fall out anyways. Now, if the owners are not willing or cannot do home care, I will extract more teeth than less, even if there's a slight compromise to them, because basically I'm trying to reduce the number of times that we have to put this animal under anesthetic. And also I want to try to reduce costs for the owner. So we try to do it, in a sense, one shop type of thing. And as a result, basically we do, go ahead and take up maybe more teeth than we would want to. And basically that's why we have to be very frank with the owners and frank about the patient, that it's willingness to allow the owner to do home care. And I'll talk about home care later on, but right now we're just going to leave it at that. The other thing is, when we have the patient there, we'll have them on intravenous fluids and supportive medications and be monitored the whole time while they're under anesthetic and on recovery. If we have multiple extractions, basically what we'll do is we will basically most likely keep the animal overnight, because it's quite painful. And when the animal goes home, it can be quite alarming to the owners, because they see basically an animal that's drooling a bloody tin saliva and doesn't want to eat. It's sore and may not be able to have the medications given to them because of the tenderness of the mouth. So as a result, for the first night, we usually try to keep them at the hospital, especially, but if it's minor, no. And a lot of times, if it's just from periodontal disease, what we do there is going to be curative. Simple as that. So as a result, if it's just periodontal disease, that's all what we would need to do. Basically, what we will do then the next day is discharge the patient. We will discharge it with pain control medication, because obviously what we're going to be doing is uncomfortable. And as a result, we'll be on for pain medication for probably 5 days, maybe. And then we'll also have them maybe on some antibiotics. It depends on how infected the area is, and those other products that we mentioned earlier. And if it has other problems like minor renal failure or something like that, we would address that at the same time. What we'll do then is basically the biopsy is the key point here, because that's going to give us the prognosis, and basically it tells us which direction that we need to go for treatment. And a lot of times, if we're doing what we call a partial mouth extraction, which means we try to leave the canine teeth in, because that way basically it leaves some integrity of the jaw and the mouth, and also allows the animal to defend itself, and gives basically the lips, doesn't just form the face or that. So usually we can save those canine teeth and sometimes incisors. So we'll try, maybe remove just the premolars and molars. And that's a partial mouth extraction. And basically with that, Some veterinarians may take longer than others, especially because basically experience is an asset there. I mean, a veterinary dentist should be able to do it faster than a regular veterinarian. I'm not saying a regular veterinarian can't do this at all. A lot of them are very talented and can do a very good job. But the most important thing is if they take out teeth, they got to make sure that there's x-rays afterwards, after the extraction, to make sure that they got the whole tooth out. Because if they leave a portion of it in, that little portion of tooth can be a nidite for the total inflammation to reoccur. So it has to be complete. So in other words, attention to detail. So that
So
whether you, sorry, go ahead.
no, I was gonna, yeah, very important that there's no root left, and the X-ray is the only way, obviously, to tell that. The question for you, Dr. Anthony, is as you mentioned in your phase two here, you've done the biopsy, you've got the patient under anesthesia, you're doing a cleaning, and you're making a determination of some of the teeth to be removed. And like you said, if the patient owner is not going to be efficient working with home care, you're going to be a little bit more aggressive removing the teeth. The question I would have for you is at this stage, would you do a partial mouth extraction based on what you see on the x-rays? Or is there a time sometimes in your phase two that you would do a partial, or do you usually wait in phase three? What's the determination for the pet owners to know, should they expect in phase two to have a partial? What's the deciding factor for you at that point?
For me, the deciding factor is basically the health of the tooth involved. For example, if it has zero attached gingiva around the tooth, we need attached gingiva around the tooth. That's the scientific term for basically tight tissue adherence to around the tooth. And it's a very small band of tissue. And if there is none, that tooth is gone. So that needs to be taken out. Second is if there's fractured teeth that have periodontal disease associated with it, deep pockets, those types of things, they need to come out. So it's based on how severe the tooth is. If it's mild, no, we can leave it. I mean, we'll clean it, do some root planing, which means cleaning beneath the gum line, and basically aid in healing. But we're not in the business of taking out teeth. I try to save them. I mean, that's why I'm a veterinary dentist. I want to save teeth, not to pull them out. So if I have to pull them out, it's for very good reason. And for me, again, I don't want to have the animal come back for a second procedure due to my, lack of attention to detail. So that's why I would basically go ahead and take teeth out. Now, when I say that, what we would do is we would call, or I'd get my technician to call the owner or the custodian of the pet to basically inform them that this is the option that we want to take and what's going on. So that way they're fully informed and are basically abreast of what's going on. And as a result, basically are part of that decision-making process, because this is a team approach. It's not just me. It's basically the pet, the owner, and the veterinarian and hospital, for that matter. Because we all have to work together for the success of this.
So phase two is a very, very important phase. So confirm the diagnosis and treatment that you've gone in depth. Again, if you just joined us, we're with Dr. James Anthony, veterinary dentist for over 30 years. And he's sharing with us his process. What steps does he take in managing stomatitis with his patients? We just completed phase two. If you just joined as well, down below you should see an address that you can go to actually get the full access of that guide, and it's free. Just go to wsow.live/stomatitis so that you can actually get a complete copy of that guide. All right, Dr. Anthony, let's go into your phase three. What do you do next, and how soon?
Before we do that, phase two is normally the most expensive portion of the whole thing, because you have them under anesthetic, and it could be for a fairly lengthy period. That if you have to do a lot of extractions, for example, and the teeth are what we refer to as ankylosed, which means basically fused to the bone. So it's like taking bone out of bone. That can be very difficult. It can be done successfully, but it's difficult. So phase 3, basically this is in a 2 to 4 week period. What I want to do is have the patient back for a reevaluation. I want to see how everything is healing and how much success we have. And normally we'll have quite a bit of success, and it may not be completely resolved, but there's usually anywhere from, I would say, a minimum of a 65% improvement to almost cured. So it can be very, very successful. The situation here is what we want to do. We will see what the biopsies say. And obviously, if it's a tumor or something like that, then we have to take a different avenue. And if it was basically a tumor, we would call the owner even before then and say, hey, we need to address this sooner, because we want to, there's many forms of treatment, such as radiation therapy, chemotherapy, combinations, a lot of different forms of treatment. So it's not doom and gloom anymore, but it's still a serious concern. But the biopsy will tell us basically how bad things are or how good things are. So that's where we will evaluate that. We'll discuss that, and we'll see how everything is healed with the mouth. And basically, if we're seeing improvement, we'll just say, hey, keep up with the home care. You're doing a great job. Let's see it, another month and see how it's going. And then if everything is great, we'll see you every 4 to 6 months after that. Or they can get their pet seen by their regular veterinarian every 6 months for a wellness exam. And part of that wellness exam should be an oral evaluation. That would be the ideal situation, where basically we've solved the problem, we move on. And with stomatitis, depending what type of stomatitis it is, and we still don't have a full grasp of what the cause is and how many types of stomatitis there are. But usually it's something that I tell owners right off the bat, this is going to be something that is normally incurable, which people get alarmed at. But then I say, but it's controllable. So with home care, with rechecks, it's controllable. And as a result, we could have a very normal, healthy pet as a result of the end of this. Now, if we see that there's inflammation on one side or one area, say we left a canine tooth and that area right around there is really ulcerative and inflamed, that's when we probably will consider maybe full mouth extraction or just taking that one canine out. It varies depending on what we see. So it may need another surgery, or in some cases, basically we have to use some other forms of medication, such as basically immune modulating therapy to aid in altering the immune system where the immune system is just not working right. And as a result, you need a little bit of tweaking with the immune system. And it can be, things like probiotics. Probiotics can be helpful in helping the oral biota, meaning the oral bacteria. It may be something more elaborate like cyclosporin or Etopica, another product. There could be other products out there as well. There's many, many products out there. And each of them can have some side effects. So as a result, this is a balancing act. We need to keep aware of basically the pros and cons of these products. And some of these products do need to be evaluated on a routine basis with blood tests and monitoring. So that's where it becomes a real issue. In my experience, the percentage of cases that need this is normally low. And to give you a round estimate, for how many, what percentage of cases need this, I would say probably about maybe 15%.
Really?
So not very many.
I,
And as a result, sorry.
so, well, I think that's an important point to discuss because your steps are very much into protecting and saving the mouth. You will extract, but another thing too I wanted to tackle, and I've heard you talk about this before. Um, Steroids. Based on what you've described so far, I've not heard you mention that you're using steroids for the patient. So, is there at any time, what is your perspective on steroids in phase one, phase two, or any phases for that matter? I think that's an important part for the audience to know.
For the treatment of stomatitis, I never use steroids.
Really?
Never. Uh, I have I have found that the cases that are quote unquote refractory, meaning that uncured and a constant problem, and ones that are really tough to treat, are ones that have been on steroids for a long time.
Okay, that's a
And
very important to note.
I prefer not to use steroids at all for this. And does it work well the first or second treatment? Absolutely. But unfortunately, the steroid wears off. And usually the steroids that most people use are a product called depomedrol or prednisone. Prednisone is given almost daily, where depomedrol is an injection that's given once a month. And the problem is that when the drug comes off, there's usually the stomatitis just bounces back with a vengeance.
Mm,
And as a result, the animal's even worse off, I find. So for me, I try not to use steroids. Now, non-steroidal anti-inflammatories I do use, but they are not steroids. They're non-steroidal.
got
Okay,
it.
so we do use those, and it's for pain control and inflammation as well. But steroids, my personal experience is not very good with it, and
Okay.
I would advise not using it.
Okay. Well, now you know, audience, because I know that's a very common question. We had a quick question as well from Ning Wong asking about probiotic. Is any specific probiotic that you've seen success with that you could recommend, or anything that you could give some advice around that?
Well, the ones that I've used very commonly is the Purina probiotics, but to be honest, most probiotics are pretty similar.
Okay.
And uh, I mean, I use Purina because it's a veterinary product, and technically they say that it's more natural for the animal, uh, for the animal's biota, meaning the animal's bacteria or intestinal bacteria. So I guess I feel a little bit better with it than using a human product. But would it be wrong to use a human product? I would say no.
Okay. Now that's good. So just so we're in phase three right now, and then we have a question from Blossom that asks if stomatitis can stay mild. So it appears in kind of recapping some of the things that you're talking about so far. By the time you've done the general evaluation, you've confirmed the diagnosis and the treatment. You may have removed some teeth. You've got a pretty aggressive approach from a home care, plan, depending on what the owner is willing to do and can do. At that point, if you've I guess for lack of a better word, if you've stabilized and you mentioned a high percentage of your patients have been in that position, can it stay mild or under control? I guess that's the question. And are you finding that through those steps, by the time you get to phase three, the ones that have responded will stay in that state for a long time, hopefully forever?
Well, usually it can be forever as long as the team works together. The patient, the owner, and the veterinarian.
Okay.
If you work together, you could have quite good success.
Yeah.
And the home care, sometimes the recheck will just say, let's just tweak this home care just a little bit. For example, I'll say, there's a tiny bit of inflammation here. Instead of giving TDC once a day, why don't you give it twice a day?
Okay.
Okay, something as simple as that.
Okay.
And and a lot of times, I also warn people that a lot of times, basically, you will see a flare up usually when there's a stressful situation going on in the cat's life. What is stress in a cat? Sometimes moving a chair, but I mean, like if you have a lot of guests over or something like that, that's usually a very stressful event for that cat. And as a result, do expect a flare up, and you may have to double the dose of those home care drugs. Call your veterinarian, ask them what you should do,
Got it.
or how what type of alteration you can do to your home care regime,
Got it.
because that way you're being proactive.
Got it. No, that's good you mentioned that because flare-ups is often something that we hear in the stomatitis group is, what happened and should I expect that? But I think being very cognizant of the environmental aspect is probably very important for the cat patient. All right. So anything else in phase three in that recheck phase? You've covered that if things go well, maintain it, work as a team with your veterinarians. If there's no improvement, then next steps can be taken with specific drugs that you started mentioning to focus on the immune modulation therapy. Um, at that stage,
Or full mouth,
partial
or another surgery.
or another surgery.
Yeah,
And
with
that
full
other
mouth.
surgery, foral mouth extraction. Got it. Is there anything that can help the audience to make that determination in discussing as a team with the veterinary dentist or veterinarian, full mouth versus partial? What's the determining factor? Should I just go with the full mouth so I don't have to do another surgery? What steps do you take to make that determination between a partial and a full?
Well, I mentioned before that basically, if we leave the canine teeth, we try to save the canine teeth because they're the major defense organ of the cat. Two, it gives integrity to the oral cavity, so it prevents loss of bone to a certain extent. Three, it gives better lip posture and whatnot, looks for the pet. And, lastly is I want to save teeth. It's simple as that. Not pull them out. And as a result, I try to save them if at all possible. But if they're already too far gone, I'm not going to leave them there. That would
Mm,
be wrong for me to do that. I would call the owner and say, we need to take that tooth out or the canines out at the same time because they're all affected or reabsorbing or whatever.
okay.
So, I mean, the whole idea here is not to have a make work project here. It's to do a real good job once and then just follow up and monitor after.
Got it. Got it. So through from a recheck, you can determine the severity of it, and then at that point, depending how much of the mouth is compromised, you'll make that determination if you want to remove all the teeth. Okay. So
Exactly.
we're in phase three. We've done the recheck within 2 to 4 weeks. Um, Talk to us. Anything else on phase three, or are we ready for phase four at that point?
I feel we're ready for phase four. I mean, as far as the other types of treatments of with drugs and whatnot, that's changing almost monthly right now
Mhm.
with new products coming out, and some of these products they have side effects.
Okay.
So right now, the big thing is to be aware and talk to your veterinarian about those side effects. And it's a weighing game, as far as basically the pros versus the cons. Fortunately, it's a small percentage of animals that do require that form of treatment. So
Okay.
as a result, it's not something that is really something that's needed all the time.
Got it. Very good. No, thank you for that. And actually, you've written an article specifically for veterinarians about managing periodontal inflammation. That goes into the depth of the complex cascade of inflammation that we make available to veterinarians as well. In case you're a veterinarian, please don't hesitate to contact us. We'll make that available to you as well. All right, let's go into phase four, Dr. Anthony.
Phase four is basically just reevaluations every 4 to 6 months. And again, can it be with a specialist? Yes, but your regular veterinarian should be able to identify if there's pathology, and they may want to then, if they do find some pathology, basically say, go take your pet to the veterinary dentist and have them evaluate it for you. So it's basically monitoring and making sure that you're just tweaking the home care to make it perfect. So every home care regime will vary. Every person has their own personal limitations, what they can or cannot do as far as home care. And it's up to the veterinarian to customize that home care program to meet the needs of not just the patient, but the owner as well. So in other words, if you're on the road all the time, it's almost impossible to do daily brushing, right? Unless your pet's with you on the road. So as a result, you have to modify some of that home care program to meet the needs of the patient and the client. Okay, and it will be involving tweaking home care. And if there is some pathology, we may say, okay, well, let's add this drug, not take away that. And basically, it's always important to remember that stomatitis is usually incurable, but it is controllable. And it's controllable with the team approach.
Team approach. All right. So the phase 4 is the routine follow-ups. Hopefully things are under control, either through a home care or if you've already done a partial or full mouth extraction, you're just monitoring the progress and frankly, the comfort of the cat at that point. A very quick question. I know you're a big proponent that everyone should be brushing their animals' teeth, cats and dogs, but what's the reality around cats with stomatitis? Should the pet owner even venture to even try to brush? And what would be your advice on that? Because we don't want to hurt the patient. We don't want to hurt the cat. What's your thought? Because some people, we have incredible pet parents that would do anything for the cats. I mean, in some of those groups, it's phenomenal, the efforts and the work that they're doing. What's your advice around brushing the teeth or attempting to get near the mouth?
Well, the first thing is in phase 1, 2, I will not encourage brushing the teeth. I mean, the cat is in pain. You start trying to brush the teeth and you're going to create more pain. And basically what's going to happen is the cat is going to hate the client. And I don't blame the cat for doing that because it's in pain and the client is inflicting pain onto their cat. So as a result, I do things that are very, very non-invasive as far as traumatizing the oral cavity. That's why those 3 products that I mentioned, I use those routinely. I usually will ask them to have softened food. So instead of hard crunchies, I'll just say, soften up the food, water it down. That way you have no dietary indiscretions because the same food is just watered down. The stool might be a little bit softer, but that's about it. So on phase 3, when I see them for a recheck, and if everything is good, that's when I'll start encourage them to brush. Or I'll say maybe you might want to consider using a dental diet as a treat. To me, I don't feel dental diets are needed to be given as a regular diet, but as a treat, I find it works very, very well as far as plaque prevention. And as a result, reducing the amount of inflammation from the bacteria in the plaque. You got to remember that bacteria are the initial spark of gum disease or inflammation. I mean, it starts at the activation, and when it becomes chronic, that's basically the body's own immune system reacting to the plaque. So it's the body that causes the problem, not the bacteria. They're the initial spark, and that's about it.
Yeah, I know that's something that you actually teach to veterinarians a lot throughout the world. So, and we thank you for that. Dr. Anthony, I want to thank you for your time and really taking the time to have written that guide for everyone to have access to, something that can be shared. This video can be shared, and you can obviously all access this guide. Just go to wsow.live/stomatitis. So the top front piece that Dr. Anthony was covering is actually accessible to anyone, and it's free. I'm going to do a little recap for us for the purposes of our audience. So there we go. Let's go from the start here. Dr. Anthony is joining us very shortly to cover the 4 phases that he uses in managing stomatitis. It's his own veterinary guide. Um, Dr. Anthony, I thank you for joining us. Here he comes. Dr. Anthony, tell us, what are the 4 phases that you use in managing stomatitis and can help any pet owner, cat owner?
Certainly. Without going into elaborate detail, the first phase is basically an oral evaluation and physical evaluation with a blood test. So it's basically just to see how bad things are and start seeing if it's safe to give an animal an anesthetic or if there's other factors systemically that are affecting the body's condition of the mouth. The
That's phase
second
1.
phase 2 is confirming basically your treatment and diagnosis, and that's with a general anesthetic, doing a biopsy, taking a piece of chunk tissue out and sending it off to a lab to be evaluated, and then also cleaning up the mouth with full mouth x-rays. So in other words, cleaning up everything, getting rid of all the disease process so the body is capable with healing. Where if you leave those things in, it's just going to be a constant source of irritation. So
All
we're
right.
trying to
Phase 3.
help the body heal itself. Phase 3 is a recheck in 3 to 4 weeks. See how everything is going. If everything's great, we will continue with home care. If not, we will do maybe another surgery or other forms of treatment, pulse modulation therapy, for example. And then finally, phase 4, and that's just monitoring. Maybe once every 4 to 6 months, and that could be your regular veterinarian doing that. It doesn't have to be a specialist. And as a result, we're just basically making sure that things are going well. And maybe if there's just a minor problem, we'll tweak a little bit of the home care, and that's about it.
Thank you, Dr.
I
Anthony.
hope those
We're very
4 phases
grateful.
will help you.
I think it will, Dr. Anthony. We're very thankful for your time, for the knowledge, and to help cat owners with the journey, the difficult journey of stomatitis. And folks, if there's more questions, we are always available on social media, and Dr. Anthony does his very best to answer more of your questions. Of course, he cannot diagnose or treat by social media, but maybe perhaps give you some guidance of what he does as a general explanation of what he does clinically. Thank you, Dr. Anthony. We look forward to speak with you soon, and thank you for your dedication to education.
Thanks for inviting me. It's been a pleasure. And good luck, and everybody, good luck. And I wish you all success in the world.
Thank you.